Assalamu alaikum and welcome back to Medicower on IQRA TV. This is the second part of our live show on diabetes. So if any of you are feeling brave enough to ring in and ask some questions of Dr. Liz, we'd love to hear from you. We have had some questions whilst we've been off air.
Yeah.
And I think what we need to go into is straight into those questions, really, and get on with it, really. So one of the questions that was asked was, why do I need my eyes testing every year?
Gosh, that is so important. And the reason is, do you remember we talked about the damage that too much sugar in the bloodstream does? Yeah. What it does is too much sugar damages the very, very delicate blood vessels.
Okay.
And we have tiny, really delicate blood vessels right in the back of our eye, in the retina. And if you have poorly controlled diabetes, those blood vessels will be damaged. And therefore your sight can be threatened. People can become blind with diabetes.
That's really serious.
Really serious. But if you have your eyes screened every year, and what happens, not painful at all, nothing horrible, simply with a special machine, they look inside the eye and they can take photographs.
Okay.
And those photographs can be checked by an expert to make sure that everything looks healthy. If they see there is the beginning of the blood vessels not looking healthy, or there's been a problem, they can then use laser treatment, which again is not painful, and that can therefore get rid of those early changes and prevent the possibility of going on to have blindness. But those changes need to be checked regularly, so everybody with diabetes, Rabina, should have an eye check every year.
So is a year actually close enough? I mean, it seems like quite a long time, a year.
Well, if you have a check and they notice there are some problems, you may then be asked to come back more regularly than the year. But for most people who have a check and everything's fine, a year will be absolutely adequate to see how things are going. And if you need extra care, you will be then brought back more regularly. And can you think, I mean, our eyes are so precious.
Yes, absolutely. Yeah, another reason, well, all of these are reasons to look after ourselves when we're diabetic, aren't they? The other tests that we get are to do with our blood. And we don't just have one blood test done, do we? We're asked to check our blood ourselves. And then there's one blood test that happens at the annual review called the hasb-e-haal. What are all these blood tests for?
Well, you're absolutely right. There are a lot of blood tests. And let's think again about why do we have them? Well, when we have diabetes, we want to see how well controlled our diabetes is. So you mentioned a particular test, the hasb-e-haal, and it doesn't matter what its name is. It's a long-range test. It tells us how well our blood glucose or blood sugar levels have been over the preceding probably 3 months. In other words, if there's been too much sugar in our bloodstream for the past 3 months, that level will be high.
Right.
If our blood sugars have been at a good, healthy level, the number will be less. So by measuring that, we actually have a really good way of knowing how well our diabetes is controlled. Compare that, Rabina, to getting on the scales and seeing how much you weigh. You need to know what you weigh, and so you need to do a measurement. Same as if we want to see how tall we are, we need a measurement. And so it's exactly the same. It's a measurement to see how well controlled our blood sugar has been over the preceding 3 months. And usually our treatment will be designed around the result. So if the result shows our blood sugar levels haven't been very good, that's an indication we need to either start some treatment or to take on extra treatment.
So when the diabetic patient themselves is checking their blood, what's going on there?
Right. If we were to check your blood or my blood now by pricking our finger, that will be like a snapshot. That will tell me what my blood sugar is at this moment. So for instance, Rabina, if just before I came here half an hour ago, I'd had a fabulous bowl of curry, 2 chapatis, followed by a large piece of chocolate cake, I could expect if I prick my finger that my blood sugar will be high. If, however, I'd not eaten anything all day, I've been really busy at work, not had chance, my blood sugar would be low.
Okay.
So that is a snapshot. But what we really want to know is, over a longer period of time, how has the blood glucose level been? So this is a very useful test, as a prick now. It's like doing a snapshot. But for most people to decide what treatment they need, I need a better measure of what's been happening for a longer time. So that's where the difference is.
Okay.
But do you remember we talked about there are complications with diabetes, like, for instance, heart attacks?
Yes.
So one of the blood tests you will have done at your annual check will be to measure how much cholesterol is in your blood, because cholesterol is a fat, and it's the fat that blocks the artery. So arteries are just pipe work. So we've got pipe work taking blood to my heart, so my heart can work properly. I've got blood going to my brain, so my brain works properly. I've got blood going to my legs, so my muscles can work.
So it's the roadworks.
It's the M1. But the trouble is, if you have a blockage on the M1, or even a partial blockage, if you go down from 3 lanes of traffic to 2, there's not as much getting through. And it's cholesterol that causes that narrowing or that blockage. So if I have a high level of cholesterol, I really want to bring it down.
I'm going to bring you back to that because we've got a call waiting.
Right, let's go for it.
Okay, caller, assalamu alaikum. Who's calling?
Assalamu alaikum, doctor.
Walaikum salam.
Good evening.
Can I ask the doctor, please, can you give some detail about the migraine headache, please?
Right, so...
Not about diabetes today.
Well, gosh, migraine...
Because one of my friends has got a 30-year headache now.
Pardon, 30 years?
Headache, migraine headache.
Right, so we're not talking about somebody with diabetes who's got a headache. We're just talking about somebody who has a bad headache. There are lots of different reasons for headaches, and one of the most common reasons is tension or stress or anxiety. And that's a very different sort of a headache and needs a very different treatment to somebody who has a headache such as a migraine headache. And a migraine headache is very often to do with the blood in the brain tightening up, so not as much blood is getting through. And it can often start with problems with the eyes. You can, for instance, have some visual problems. But every headache, we need to know what sort of a headache it is, what the cause is, so that we know what the treatment is.
This gentleman's talking about this person's had a headache for 30 years. So what does this patient need to do to help themselves?
If you've had a headache for 30 years, it obviously isn't a life-threatening thing. So presumably they've already taken advice, or perhaps this is somebody who tends to have tension headaches. The headaches come and go, perhaps tied in with if you're anxious or worried. And have they had their blood pressure checked? Have they been to see, have they got some arthritis in their neck? Is that what's causing some of the pain in the head? It's very difficult without having the person and being able to examine them. For instance, sometimes we look into the back of people's eyes when they have bad headaches. So lots of reason for headaches, but really the best thing is to go and see a doctor face to face so that it can be properly investigated. Migraine, if it's a migraine headache, there are very special tablets for migraine headaches which can either be taken on a very regular basis to prevent the migraine coming, or for some people, if it only comes every now and again, there is a tablet you can take just when the migraine's starting. But you need to know for certain what the headache is, so you tailor-make the right tablet for that sort of headache.
I hope you found that useful, caller, and we wish you well with your future help. So I think, did we have another call? Okay, sorry, no, not another call. So we are on the subject of diabetes today. So if you've got any calls specifically about diabetes, we'd like to hear from you in relation to that, as Liz is a doctor who deals with patients with diabetes. So we want to get the best out of your expertise on this.
Can I just say that there's no specific headache tied in with diabetes specifically. So whereas anybody with diabetes can get any sort of problems, it's not a specific diabetes problem.
I'm not sure our caller was saying
No,
it's to do with
I
that, whether-
understand, but just in case anybody's confused.
Yeah, absolutely, really helpful to have that clarification. Thank you. So before we had our caller, we were talking about what were we talking about? Cholesterol.
We're talking about cholesterol, measuring cholesterol, and if the cholesterol's high, then there are tablets which in fact most people with diabetes will be taking, and these tablets, the group of these tablets are called statins. So for instance, atorvastatin, simvastatin, pravastatin, there's quite a few different ones, so different people may be taking different tablets, and all these tablets have different strengths, so the strength will depend on the sort of tablet and also on the level of cholesterol.
Okay. People worry about statins. There's a lot of information out there that people talk about side effects of statins.
Well, let's accept there is no such thing as a tablet that doesn't have a side effect. Just think of people who take even paracetamols. Most of us would think nothing of taking a paracetamol, and yet for some people they don't agree with them. So all tablets will for some people cause side effects. The specific side effects which have been linked with statins can be that it can cause aches and pains in muscles, usually big muscles, so the muscles of the top of your legs or even your shoulders. And so for some people that can be quite uncomfortable. Some people find they don't sleep as well if they're on a statin. So you can change from one statin to a different statin, because perhaps there's one tablet that upsets you but the other ones don't.
I think we've got another
You
call.
can try reducing the dose.
Okay.
Go on then, let's have our next question.
Let's go to our next call. Thank you. We'll come back to that. Assalamu alaikum, caller.
वालेकुम अस्सलाम।
Well, who's calling?
मेरा नाम कुलसूम है, मैं स्कॉटलैंड में से बोल रही हूँ मधुबन।
कुलसूम, आप इंग्लिश में बात कर सकते हो या नहीं?
जी है।
Please.
I have diabetics from 3-4 years now, and I'm taking metformin 2 morning time and 2 night time, and plus I take glycoside or something called.
Glycoside?
Yeah.
Yes.
And plus Invokana.
Yes, Invokana, yes, I understand.
And sugar level is before food it was 7.5, and after food is 11, 12. I'm trying my best not to eat any sugary things. And now for a few months I started getting too much pain in my legs from knee to down to the ankle, and so sensitive. My legs are so sensitive. Even if one of my grandchild, they come and they wanted to give me big hug, and I'm trying to tell them not to touch my legs. If they touch my legs, it's so painful. I can't bear. And I asked my diabetic nurse this week, and she asked me to go to the doctor and show them, and I go to the doctor and she gave me water tablets.
Okay.
Right. So first of all, thank you very much for ringing up, and that's very interesting to hear that you're taking 3 different tablets for your diabetes, and that is a very normal thing, that one tablet on its own will not control the blood sugar well enough, so you do need several tablets. The numbers you mentioned, 4 or so before you eat, is a very good blood sugar level. And you mentioned that after you eat, it may go up to around about 11. Probably we would be very happy if it was under 10 rather than just over 10. But altogether, that's showing really quite good control of your diabetes. I congratulate you that you are aware you have to be careful about what you eat and that you try hard. And I think I do understand how difficult it is. And you probably notice that some foods will put your blood sugar levels higher than other foods, or perhaps if you have a bit more some days than others. So what you're saying is absolutely fine. Your question, though, was why are you getting such pain in your legs?
Yes, please.
So I'm scratching my head because I know diabetes can affect your feet and can cause pain in your feet, but
Yes.
the problem with your legs you've told me that it's any time. It's not a pain if you're walking, it's a pain that's there all the time.
All the time, I can't walk more than 5 minutes, 7 minutes.
Okay.
So if you're just sitting as I am now, would you have pain in your legs then?
Yes.
Right.
Even sitting, even nighttime when I'm sleeping, sometimes I wake up with pain and I start moving, like doing exercise. Sleeping, while I'm sleeping, I'm just moving my knees and my feet, you know. So I feel like somehow the pain maybe stop if I do exercise or something, but it's not.
Well, diabetes does not cause pain in your legs if you're not walking around or doing anything. If you have narrowing in the blood vessels, then you can get a pain when you walk. But a pain when you're not doing anything isn't something we would normally link with diabetes. You mention a pain in your joints. I'm thinking of arthritis. So arthritis can be painful even if you're not always walking. You mentioned you've been to your doctor and they've given you a water tablet.
Yes.
Now, a water tablet is if you get very swollen legs. So,
But the legs are not very swollen.
They're not.
but there must have been a reason why the doctor thought that tablets for some swelling could be helpful.
Yeah.
Perhaps the doctor thinks that your legs have become slightly swollen and is wondering if that's anything to do with the pain. So I'm sorry I can't give you a clear answer. I think obviously you need to be checking this up with your doctor, but diabetes on its own should not cause a pain in your legs.
So it sounds like there needs to be further investigation, Sister Kulsum, for you to get some further answers. So we wish you, shifa, inshallah, and pray that things go well for you. May Allah make it easy for you, sister.
Amen. Thank you.
Assalamu alaikum.
Thank you.
Thank you for calling. Yeah, difficult when we sort of think everything's connected to something we're being diagnosed with sometimes,
Yes,
don't we? And
you're
actually it could be
right.
something totally
Yeah.
different.
And I think we shouldn't take it for granted that it is just, oh, well, I've diabetes, therefore I will get whatever the problem is. Things do need checking on. But if you've had diabetes for a long time, well, our lady that's just rang us, it was only 3 or 4 years, so that's not very long.
No.
But I think obviously these things do need checking up on.
Do you think sometimes some of our medical professionals get a bit tunnel visioned when you've been diagnosed with something and they always think, oh, it's to do with that, when actually they could be investigating it in a different way if you didn't have a condition already?
I think that what we're doing is we're underestimating that the person who you go to seek advice from will have asked lots of questions to understand what's going on before they come to a decision as to what it could be linked to. I think you are right, though, to a large extent. It's easy to say, oh, well, you've got so-and-so, so that will be why.
But our doctors are detectives. I mean, when I'm teaching medical students, one of the things I'm often saying to you are like detectives.
Yeah.
You've got to find the jigsaw pieces
Yeah.
to help make the full picture. But actually, as patients, we need to be thinking about how can we make that easy for our doctor as well.
But I think as well, the doctor has to ask the right questions. I mean, I was
agree.
talking about my car.
Yeah.
I don't know that the signs that my carburettor isn't working could be a funny noise.
Yes.
So I don't think to say, oh, it makes a funny noise sometimes. But if the question from the mechanic is, does it sound all right? Then I might say, oh, well, no, it makes some funny noises. So doctors need to ask the questions which are linked to various symptoms to understand more what's going on.
Thank you. That's really helpful. We were talking about statins.
Statins, and One thing is, as I was saying, it can cause problems in the muscles, but tends to be the top of your legs.
Okay.
And I don't know if our lady who was ringing up, she didn't mention taking a statin
didn't,
tablet.
yeah.
Maybe she just concentrated on the diabetes tablets, and maybe it's worth her discussing that question with her doctor. Could it be tied in? Sometimes you can stop taking a tablet like a statin. Now, you need to take medical advice before you stop any tablets. But sometimes if I see somebody who wonders if their problem is due to the side effects of a statin, I feel when I know the person, I can safely say, let's just stop the statins for a couple of weeks and see if the pain gets better.
Yeah.
And then let's you and I meet up again in 2 weeks. If the pain has gone, then we can say it does sound as if it's the statin.
Yes.
But if, as often happens, the person says, well, I've still got that pain, then I can say, well, let's go back to the statin. And it may be perhaps an arthritis or something else that we then need to look into.
Liz, we're actually coming to the last 5 minutes of the show, so it's whizzed by again today. And I just thought, rather than me asking you further questions, I know we've had questions about feet, and we've had questions about medication and sort of how do I know that I've got diabetes. I think I'm going to throw it over to you today in the last 5 minutes. What would you like to discuss with our viewers so that they get some useful information at this point?
I think what's very important is, if you have been diagnosed with type 2 diabetes, then it's very important to understand how much you can do to help yourself. And that will be thinking about the food you eat, thinking about weight, if needed, losing weight, thinking about lifestyle, as in exercise, getting plenty of activity into your life. If you are given tablets by your doctor for your diabetes, understand, ask questions to understand what those tablets are and what they should be doing. Ask what the side effects are, because we've mentioned tablets can have side effects. Understand what the problems are you could have, and then you can always go back and talk about with your doctor what you should be doing. But if you are given tablets, try to stick with taking those tablets as often as you should be. So it may be just a once-a-day tablet, it may be a twice-a-day tablet. And go for your regular checkups. We've mentioned, Rabina talked about going for eye checkups. Very important. Eyes are so precious that you go for your annual retinal check. Every year, your practice nurse, maybe even more than every year, will want to do blood tests to check and see that your diabetes is well controlled, that your cholesterol levels are well. Oh, and we haven't even mentioned the importance of blood pressure, having your blood pressure checked. And you may need tablets for your blood pressure. Blood pressure is important because we mentioned one of the complications of diabetes can be heart attacks. So having a low or a very healthy blood pressure, it has a protective effect, stops your heart having to work quite so hard. Gosh, there's a lot to say, isn't there?
There's a lot to say, and it's a subject that I think we can talk about for so much longer.
Yeah.
But I think what you've been reminding us of is all the reasons why we need to keep on top of this. We need to not underestimate how important it is to actually think about what we're doing when we're diabetic, because it isn't just one part of the body that this affects. It has the potential to harm all parts of our body because of that sugar freely roaming around our body. And and there's no denying that it's a challenge for anybody in this situation, as with any chronic health condition. But what we hope our viewers will do is not only take note of what you're saying, but also try and build a relationship with your GP yourself and your diabetic support team to see how they can get the best out of you and you can get the best out of them. And I would certainly encourage any patient with any condition to think about how they can put down some questions before they go. And if you're finding that you're not getting there, then maybe think about, do you need to see somebody else? But certainly take responsibility, and at the same time ask, because it's through asking that we learn. Unfortunately, it's come to the end of the show. It's been really lovely having you here again, Liz. I look forward to seeing you again. So for everybody out there, I pray that inshallah you are able to look after yourselves more. Please take care, look after yourselves. Remember me in your du'as. Assalamu alaikum wa rahmatullahi wa barakatuh.